Hi, I'm Dr. Olga Pinkston, a board-certified rheumatologist and the host of the Mind Your Fibro podcast. This podcast is dedicated to fibromyalgia. I discuss up-to-date information about fibro, its treatment, the biology and psychology of the fibromyalgia. I cover the pain science education, the complementary and alternative methods available to you now to improve your symptoms. There are a lot of things that influence development of fibromyalgia, trigger fibro flares, and produce other symptoms like IBS or irritable bowel syndrome, depression, and anxiety, and none of them are your fault. In the Mind Your Fibro podcast, you will learn how and why fibro develops, how chronic pain changes your brain, and most importantly, that you're not alone in the struggle, that fibro is real, and how to not let fibro control your life. This podcast provides information only and does not provide any medical or psychological services or advice. Well, hello, my friends. Welcome back to Mind Your Fibro podcast. Today, we will continue with the next episode discussing the importance of nutrition in fibromyalgia. During the last episode, I mentioned the harmful effect of sugar on the nervous system and fibro symptoms. I get a lot of questions about sugar, so this episode is dedicated to sugar. It is actually a module from a course on nutrition, mindful eating for autoimmune conditions, chronic pain, and fibromyalgia. So instead of re-recording it for the podcast, I'm sharing with you the entire module. Audio is a podcast and video with slides on YouTube. It is packed and covers information on sugar, its effect on the development of the disease of both adults and children, sugar addiction, and fatty liver disease. This episode will provide information for anyone, not just people with pain, so please share it with your friends and loved ones. If you have any questions or comments, please email me. You can find my email in the show notes. Well, welcome back to another module. Today we're talking about sugar and how to eliminate sugar from your diet. It is probably one of the most important modules of this entire training. If you don't do anything else for your health, removing or eliminating sugar from your diet will yield the best result and will improve your symptoms. When I talk about sugar, I'm also talking about other sweeteners, including highly refined sweeteners like corn syrup, as well as molasses, brown sugar, any kind of syrups, as well as honey. Anything that's refined or concentrated and it raises your insulin rapidly is named sugar in this lecture. So the American Heart Association suggests an added sugar limit for a reason. Sugar causes a lot of inflammation and worsens many conditions. So how much sugar is too much in a day? For women and children between ages 2 and 18 years of age, no more than 100 calories per day, or about 6 teaspoons or 24 grams of sugar per day. It's easy to count teaspoons. 4 grams of sugar is 1 teaspoon, and children under age 2 should not have any sugar at all. Men can consume up to 9 teaspoons per day, but in reality, both men and women consume about 24 teaspoons of sugar per day. There's absolutely no nutritional need or benefit that comes from eating added sugar, only pleasure. Eating a lot of added sugar early in life is linked to obesity, high blood pressure, and type 2 diabetes in adults. So if you have a child who consumes a lot of sugar at a young age, and some children consume a lot of sugar before age 2, they're being put at risk of developing chronic conditions later in life. Also, we see a lot of children now being obese, some of them extremely obese, and we also see an increase in diabetes rates in children, including toddlers. So if you're noticing your child eating a lot of sugar, it may be in the form of cereal or in the form of sweet milk like chocolate milk or strawberry milk at school, just be aware that sugar consumption in children is linked to health issues in adults. So when we talk about added sugar, we're talking about the sugar that's being physically added to that food. It is not a sugar in an apple and it's not a sugar in a banana, but really a sugar in any baked goods or any foods that have sugar like yogurt or drinks. For example, one apple, a sweet apple, will have 2 cubes of sugar, or two servings of sugar versus a banana. Banana will have more sugar because it is starchy, but it's still not added sugar. It is not as bad for your health as something like a donut or a pastry. As you can tell, those desserts have way more added sugar, not natural sugar, in them. And why is it important? Overconsumption of sweet foods leads to many chronic conditions, but also our body does not process foods in the form of added sugar as well as it does foods with fiber, like an apple. No one ever told me, oh, I couldn't stop eating apples. I ate a bushel of apples and I just could not stop eating. But I can tell you, I have eaten pastries and cookies and cake, and it's easy to overeat those sugary desserts. It is easy to eat more than one donut. It is very easy to eat more than one cupcake. Not so much with bananas or apples. So those highly processed foods that we consume and often consume on a daily basis are highly inflammatory. They are and also have many calories. How much sugar are in the drinks? I can tell you many people do not count drinks as food, but in reality, many drinks have a lot of sugar and a lot of calories from sugar. So, for example, sweet iced tea will have more than 8 to 10 teaspoons per servings. Slushy can have up to 25 teaspoons per cup. Lemonade, even though it is lemon, is a fruit, it has mostly sugar, up to 16 teaspoons per bottle. Soda has as many, if not more. So if you're drinking lemonade thinking that you're eating a healthier or drinking a healthier alternative, just know that you're drinking as much sugar as Coca-Cola, for example. Some drinks and juices will have as much sugar as several Snicker bars. Some juices are very concentrated. It takes a lot of fruit to make a cup of juice. It takes several apples to make a cup of apple juice. Apple juice has no fiber, has a lot of sugar, and you will likely not eat 6 to 8 apples in a row, but you can easily consume as many apples in a cup of juice. Also, cereal. Many of my patients struggle with being overweight or having inflammation, and yet they eat a lot of cereal. Cereal is loaded with sugar, and even the healthier alternatives, organic cereals or bran type, or even instant oatmeal has a lot of sugar. An average box of cereal contains almost 20 grams of sugar for every 100 grams of cereal. And I can tell you, most people, including most children, do not consume one serving of cereal at a time. Americans consume about 10 pounds or 160 bowls of cereal per person each year. That's a lot of cereal. Also, cereal is usually eaten with milk. Milk has also a lot of sugar in the form of lactose, and some people are also intolerant to milk and they don't know it. Milk can be very pro-inflammatory as some other type of dairy. So when you're consuming cereal every morning and you think that you're doing yourself a favor, think again, read the label, look how much sugar you ate in the morning, and also notice how soon you will be hungry again. Many teachers complain when children come to school, they are already hungry because they ate cereal for breakfast, a bowl of cereal with some milk, and that's it. They don't have protein, they don't have fat, and within half an hour to an hour later, they are already hungry. They're having a sugar crash after eating a lot of sugar for breakfast. So why is sugar so bad for you? Sugar is implicated in many, many conditions. A lot of them are industrial countries' conditions, such as obesity or being overweight, type 2 diabetes, heart disease. It's also implicated in some types of cancers, gum disease, and tooth decay. We know that gums and oral health is extremely important in some conditions, like some autoimmune conditions, as well as it can be a cause of inflammation. We know that people who consume a lot of sugars don't live as long. We also know that we see in early puberty in girls. Girls who are overweight or have diabetes or consume more junk may have early puberty. Also, I see more pain in patients with osteoarthritis, inflammatory arthritis, and fibromyalgia in my clinic. Some conditions it's very hard to control until they eliminate or reduce sugar. I can tell you I had a patient who was on 2 or 3 medications for rheumatoid arthritis, and he could not control his rheumatoid arthritis. He had a lot of swelling and pain. He was a very heavy soda drinker. He drank a lot of Mountain Dew. He cut out all soda for a week. His swelling improved. As soon as he started drinking soda again, his swelling came back, even if he drank just 1 bottle of Mountain Dew per day. So again, sugar and some other things that are in those sugary drinks or sugary foods can be very inflammatory. Another condition that I see a lot in my clinic is fatty liver disease. Fatty liver disease is extremely common. It is now the most common form of chronic liver disease in the US and affecting 25% of the population. Fatty liver disease is when too much fat is stored in liver cells. Our liver should be nice and pink under the microscope. It should have a normal architecture. But when we consume too many sugars, too many carbohydrates, the metabolism of those carbohydrates produces a lot of triglycerides or fat globules or fat droplets. And those droplets overwhelm your body and overwhelm the transport system that transports droplets to fat stores, and they get stuck in the liver. So over time, the liver looks like it's congested with fat droplets. So this is why it's called fatty liver disease. It's actually a misnomer. It's not because you're consuming too much fat. It is because of consumption of too many carbohydrates. The causes of fatty liver disease is being obese and overweight. We also see it with insulin resistance, when your cells don't take up sugar in response to the hormone insulin. We also see it with PCOS, and especially in other conditions that have high sugar, including prediabetes and type 2 diabetes. So the high levels of fat, especially triglycerides in the blood, droplets get stored inside the liver. When you eat, your body converts any calorie that it does not need to use right away into triglycerides, especially excess sugar and excess calories from easily digestible refined foods. The triglycerides are stored in your fat cells. So if your transport system is overwhelmed, if you overconsume those foods, the excess triglycerides are stored in the liver and distort architecture. If you are overweight and you're not active, you may have high triglycerides on your blood work, especially if you eat a lot of carbohydrates or sugary foods or drink alcohol. So what are the function of the liver? The liver is extremely important organ. You cannot survive without liver. If your liver is severely damaged, you may need a transplant. Liver does many things. Number 1 is filtration of the blood and detoxification. It removes all the harmful substances from your body. It helps you digest. It breaks down food for absorption. It also a major organ of your metabolism. It changes food into energy. It also a major organ that produces protein. Those are building blocks of your cells, as well as signaling molecules that are needed for functioning and healing. So if your liver is impaired, it may not detoxify your body well, so you may have more toxins in your bloodstream. You may also not digest well, so you may not break down food as well for absorption. You also may not have enough protein building blocks for healing and repair, such as wound healing. And also we see impaired liver function and low levels of vitamins and minerals, because liver also participates in the storage and utilization of vitamins. Some of the symptoms of liver disease are just fatigue until the liver disease is advanced. So you may have no symptoms but feeling just tired, feeling worn out. Until fatty liver disease worsens, your labs may be normal. So it is a very deceiving condition. You may have an abnormal ultrasound with a fatty liver on ultrasound or hepatic steatosis, and that's the only clue that you have fatty liver disease. You went to a doctor, they got an abdominal ultrasound, and on ultrasound you had fatty liver. A lot of times people don't pay attention to that. People are not discussing it, but it is a major condition that impairs your healing and also puts you at risk of complications if you're sick or unwell. Many medications are being utilized or metabolized by liver. So if your liver is impaired, it may alter the medication levels. It may also cause side effects from medications that we typically use in autoimmune conditions like methotrexate or leflunomide or other medications that are very helpful and very good for your condition. But having a liver disease, puts you at risk of developing the side effects. So major condition, we see it often unrecognized or not paid attention to, but you really need to pay attention to your liver. You only have one of them. So let's talk more about sugar. 100 years ago, the average sugar consumption per year was 4 pounds, which is 1.8 kilograms, less than one small baby being born. Now in the US, the average sugar consumed per year is 150 pounds or 68 kilograms, a size of a grown adult. So we went from not even a baby to a grown adult. Sugar is one of the most common additives to many foods and is hidden in sauces, breads, foods that used to be consumed unsweet. Even some cheeses have sugar added. Some additional condiments, for example, ketchup or barbecue sauce. The food industry does this on purpose because sugar is addictive. Now, emotional and psychological dependence on sugary foods and drinks, also known as sugar addiction, is real and may be hard to treat. Sugar addiction is not imaginary. We see it very often, but it may go unrecognized because sugar addiction is not as harmful as alcohol addiction or drug addiction, in not as perceived as such in our society. It's still very harmful to your health. Eating sugar releases opiates, which is our natural pain relievers, as well as dopamine in our body. Dopamine is a reward neurotransmitter or brain chemical. This is the link between added sugar and addictive behavior. Dopamine is a neurotransmitter, which is a key part of the reward circuit associated with addictive behavior. Approximately 75% of Americans eat excess amount of sugar, many of whom could be classified as having a sugar addiction. Some studies suggested that sugar addiction is real and sugar can be as addictive as cocaine. Hard to believe. Sugar consumption can create a short-term high and a spark of energy in the body. And after that, you may have a low, and that will produce a craving for a sugar high. Like other compulsions and behavior addictions, sugar addiction is a special risk for people with chronic pain, anxiety, depression, stress, and history of trauma. People who suffer from constant tiredness or fatigue also eat more carb-rich sugary foods for an energy boost. People may begin to crave sugar to balance irritability, emotional lows, and other feelings. I'm sure we all felt sugar hangry at times and needed some sugar. Now, all addictions are complicated. We have biochemical and physiological components as well as relational and attachment component in addiction. If you are addicted to sugar, you are most likely sugar sensitive, someone who has a biochemical sensitivity to sugar. In your body and brain, sugar acts like a toxic drug. Eating it makes you crave more, and once you start eating, you may find it's hard to stop. Your sensitivity to sugar may arise from low or volatile blood sugar, unhealthy gut, for example, hormonal imbalances like insulin imbalance, diabetes, or brain that is low in neurotransmitters like dopamine and serotonin, as we see in depression and other mental health conditions. Addictions also have an emotional component. These are deep, unmet emotional needs for understanding, validation, empathy, love, compassion, and care. Addictions are also relational, how connected we feel to each other, to ourselves, to spirit, God. In absence of loving connections, we seek out substitutes in form of addictions. not just food addiction or sugar addiction, but also alcohol, drug addiction, etc. Sugar addiction can be learned. Sometimes it is inherited, and sometimes it is triggered by early trauma. Most often, sugar addiction is not your fault. Something happened to you while you have this sugar addiction. If your parents tend to overeat sugar, you may inherit this trait. Some studies showed rats having genetic predisposition to overeating and addiction. Also, early trauma appears to influence the way our bodies handle sugar, and more specifically, how insulin rises when we consume sugar and in any of its form, whether it's from alcohol, starchy foods, or sweet substances like sugar. So normally the hormone leptin, as we talked before, is secreted in response to a burst of insulin. This tells your brain that you are full, you had enough food. But when insulin levels are chronically elevated, for example, people overconsume food, they eat too much sugar, or they're under chronic stress, or they have insulin resistance, some people's receptors will begin to block the leptin. It is secreted but never causes the full feeling, resulting in food cravings and constant feeling of hunger. Often I hear from patients, I feel hungry all the time. I don't know why I just ate, but I need to have another meal. That's often because of the insulin resistance and also because of that leptin dysregulation. Trauma causes hormonal and neurological changes that interact with genetic, social, and behavior stuff. The stuff that was always assumed be the whole cause of the weight problems. Oh, it's your genetics. It's your mom was obese, that's why you're obese. Or social, or you're surrounded by people who overeat or eat wrong foods. Or behavior, you comfort or stress eat. But many times people or my patients will have the trauma that induced the hormonal changes, that also in the environment with poor social support or genetics or behavior issues just combine and make it an overwhelming condition to treat. Very often, sugar addiction may start as early as childhood. It may be the only way a parent knows how to show her love to a child or reward a child for good behavior. Parents also maybe feeding children sugar because she wants to eat sugar. So she doesn't feel like guilty buying sugar just for herself. I see this with some people who have young children and the children eating a lot of sugar, a lot of candy, a lot of soft drinks because the parent doesn't have the boundaries to tell the child no. But also the parent may feel guilty that they're setting a wrong example. So it's much easier to the whole family eat sugar than just a parent. Parent may not be aware of how much sugar a child consumes. It's because it's not just sweets, also added to cereal, yogurt, condiments like pickles, bread, ketchup, etc. Also, a child may be a picky eater, and she or he is rewarded with sweets after finishing a meal. Child may be cranky, needy, emotional, and she may be calmed down after she eating sweets. Again, this reward and feeling pleasure from sweets starts early. Children can self-regulate with comfort foods just like adults do. And also, the calmer child can give a parent a break. So if the parent cries, if the child is needy or emotional, giving something sweet will give a parent a break. Child's nervous system is dysregulated due to trauma, emotionally unavailable parent, a parent who lacks boundaries, parenting skills, nutrition education, understanding of how to provide emotional support to a child without utilizing food. This child may grow up regulating herself with food and sugar. If the parent self-regulates with sugar, she may regulate her child with sugar. Our society also rewards and creates positive experiences using sugar. Birthday parties with cake, after-school snack, post-game sugary treats, gummy bears, cupcakes, donuts. The child finds the way to fill the emotional gap and practices reward system using sugar. So people who experience emotionally stressful situations like chronic pain or chronic illness, relationship or work stress often turn to sweets to comfort themselves during the difficult time. those who turn to sugar to deal with emotional issues are more likely to become addicted. Not everybody who eats sugar is a sugar addict, but many people who overconsume sugar may find themselves being addicted to sugar. Other indications of sugar addiction for emotional relief are weight gain and difficulty focusing on daily responsibilities. Sugar addiction and binge eating are often go hand in hand. Binge eating is eating too much and too fast, followed by feeling guilty, ashamed, and disgusted by those actions. Binge eating can be an eating disorder. So if you're having those tendencies, you have to speak to a mental health professional or primary care. Also, this can damage self-esteem, cause feelings of helplessness, and lower self-worth. This in turn leads to more sugar consumption and more severe sugar addiction. Again, sugar addiction and alcoholism. As I said before, not everybody who consumes sugar is a sugar addict, just like not everybody who drinks is an alcoholic. But with alcoholism, we have clear symptoms of alcohol abuse. We have intoxication, we have loss of job or relationship problems. With sugar addiction, we often don't see those negative effects except for obesity or excess consumption or binging for obesity or complications like diabetes. So sugar addiction is not as visible and more accepted in our society than alcoholism. But there's a surprising genetic link between children of parents who abuse alcohol and sugar addiction. A recent study confirmed dopamine receptors in the brain light up when sugar is consumed, like the receptors light up in the brain of someone who abuses alcohol. This can encourage people who struggle with sweets to develop alcoholism. Alcohol-dependent people may have a higher desire for sweets and experience sugar cravings and sugar withdrawals, just like they may have alcohol withdrawal and alcohol craving. The genes in parents who abuse alcohol, as well as their preference for sugar, can be passed down to their children. As a result, the child may have a predisposition to both of these addictions, sugar addiction and alcohol addiction. Bottom line, sugar addiction is real. Sugar addiction needs to be recognized and evaluated if you're trying to remove sugar from your diet. You need to be aware of the reasons why you may be addicted to sugar. If you struggle with sugar addiction or just overconsumption of sugar and recognize patterns of past trauma, you need to work with a mental health provider as you detox from sugar, as it may trigger worsening depression, anxiety, and labile mood. The research demonstrates that the effect of sugar addiction, withdrawal, and relapse are similar to those of drugs of abuse. So what do sugar cravings feel like? I think we all know those feelings. We all may crave sugar, want something sweet after dinner, but people who eat a lot of sugar and stop eating sugar will have a very strong urge to eat something sweet and can find it difficult to control themselves around food. This can also lead to binge eating and over-consuming calories, sometimes on a regular basis. Many sugar cravings stem from a blood sugar imbalance. When your body ingests sugar, your blood sugar spikes and your body releases insulin to lower it to a safer level. If the insulin brings your sugar level a bit too low because you're used to eating a lot of sugar, as it often happens, your body starts craving foods that will raise the sugar level or glucose level and increase your energy. Sugar withdrawal. We eliminate sugar from our diet. We find ourselves experiencing withdrawal symptoms. Usually the symptoms are irritability, fogginess, moodiness, and low energy. Good news is that those feelings are rather temporary, but the withdrawal and cravings can be very intense. Many people choose to go back to eating sugary foods because they need to stop the cravings. Mayo Clinic recommends taking at least a 2-week break from sugar to reset your body and reduce your craving for sugar. Sugar withdrawal is real, and improves with time. Usually after a week, it's not as intense. After 2 weeks to 3 weeks, you start craving less and less. Usually within 4 to 6 weeks, you stop having desire for sweets, for sugar. So you may do it cold turkey or gradually, but you need to give yourself a deadline. How to kick a sugar addiction? Number one, be aware of how much sugar you consume. Make an honest list of what you eat and drink. If you don't know, it's hard to change. If you're not honest with yourself, again, you will not be successful. Make a plan and stick with it. As a first step, stop soda and any sweetened drinks first. It may be sweetened coffee or tea. It may be chocolate milk or cocoa. It can be coffee with creamers. Creamers have a lot of sugar. So stop all drinks that have sweeteners. I also recommend stopping milk if you're an adult, because milk has a lot of sugar in the form of lactose. If you have a child who's obese, you need to really monitor how much milk this child consumes. Recommended amount for children is no more than 3 cups per day, and it's usually 6 to 8 ounces. And I know many children consume way more milk than that. Aim for less than 5 grams of added sugar per serving as you're trying to detox from sugar. And then later, eliminate all added sugar. Read all labels. Sugar is disguised by many names. Stay away from any baked goods, desserts, and candy. If you're trying to eat better, eliminating white flour and white sugar is a huge step you can take. If you look at any food and if it has sugar or has flour, it's easy to spot and should be easy to say no. Also try to stay away from cereals, healthier options like packaged oatmeal. They still have a lot of added sugar. Also be aware that pizza and pasta sauces have added sugar. A half a cup of store-bought marinara sauce contains anywhere from 2 to 4 grams of added sugar per half cup, which amounts to a teaspoon. So if you're using a jar of pasta, you may have up to half a cup or more of sugar in a jar. So read the labels. Sugar is disguised by many names. It can be called brown sugar, corn sweetener, corn syrup, fruit juice concentrate, high fructose corn syrup, honey, inverted sugar, malt sugar, molasses, and anything that's on O's, dextrose, fructose, glucose, lactose, maltose, and sucrose. All of those are sugars and they are not good for you. Well, I hope you found this session informative and motivational. I know sugar addiction and consumption of sweets is a problem for many of us, including me. So we need to really work on eliminating those foods from our diets, because I know the less sugar you eat, the better you feel and longer you live, and better you live longer. Thank you for listening. Thank you for listening to this podcast. If you enjoyed today's episode, the best thing you can do is to share it with someone and leave a review and rating. This helps me support more people just like you move toward better life with fibromyalgia. All you have to do is to go to the platform you're listening on, click the share button or the icon, and just send it to a friend. I so appreciate you taking your time to do so. Make sure you sign up or subscribe to this podcast so you can get the most up-to-date information in the new episodes. Thanks for joining me today, and I will see you next week. And don't forget to mind your fibro. Disclaimer: this podcast provides information only and does not provide any medical or psychological services or advice. None of the content on this podcast prevents, cures, or treats any medical or mental condition.